Now we'll try to answer a very important question, which is basically part of the ethics of radiography. So when you are starting radiography, they'll tell you one thing, that you always communicate with your patient, you ask them questions, and you allow them to ask you questions. You don't be offended by that. And for anything that you need to do on the body of the patient, you're always telling them, okay, because you're not dealing with animals, so to say. So why is it that a patient needs to be given an explanation of the procedure that is to be done? Is this important? Okay. So the patient needs to be given clear explanation. Why? Because there's informed consent. The patient has the right to say no, because it is their body. Okay. So they have to agree. It should be voluntarily. So you also reduce anxiety. So instead of a patient seeing machines that they have never seen before, seeing you operating things that they don't even know what you are doing, at least they know what you are doing, and it calms them down. Cooperation and positioning. Because the patient knows what is happening, if you tell them to lie in a particular way, or breathe in and breathe out, all of that, they will be able to do it. So the patient understands everything and the steps and the importance of this thing to them. They'll follow your instructions. So safety. Patient needs all the aprons, shield, and all of that. And sometimes they don't need to be moving too much. So if you have explained everything to them, they'll follow these instructions in a better manner. Building trust. It shows you that you respect them and you are professional. So patients will feel much more informed, they'll feel much more respected. Legal and ethical responsibilities is, most of the times they have to sign. So when they sign, even if issues come up later and you are sued, you are basically vindicated with that. Okay, having a proof that, okay, I actually told them that this is what will happen, but they said yes.